Well, good just afternoon. It's just noon right now. And thank you again for joining us for our Houston Business Forum on COVID-19. My name is Carrie Broderson, and I run our events and business resource groups at the Greater Houston Partnership. And we're pleased to bring you another one of our Business Forum series on COVID-19. Today's event is on managing COVID-19 cases in the workplace. And I know that we have produced a couple of these sessions for you throughout the last couple of weeks. But we know we do have some new information to share with you all today. So we're so very pleased that you've joined us. You might recognize the fact that we are not doing our COVID-19 forums as frequently. We used to have every Tuesday and Thursday. But we want to assure you that we'll continue to deliver these programs on a timely basis and as needed, and ensure that you're getting information in a timely basis. You can also visit us on our website. We do a partnership daily briefing that comes out, and we just want to make sure that you're also having access to information in other formats. So we do want to keep you informed. So as we progress through today's event, a couple of procedural mentions. You are all very experienced now on our Zoom webinars and meetings, I am sure. But if you just you familiarize yourself with your screen and your toolbar, we do use the chat feature for our program today for comments and any technical issues. So take a look at that. We're also going to be posting links, and we'll make sure that we're getting some links up there that you can then use to follow us throughout today's program. The Q&A tab, however, if you would put your questions directly for the speakers on that tab instead of on the chat bar, because that'll help us and we'll be able to cycle through those. And we're also going to be able to answer a lot of those questions as well. And then the raise your hand feature, this is helpful for us because if you are trying to get in touch with us and we haven't been able to see your question or your comment in chat, if you use that raise the hand feature, then it'll alert someone on the staff to direct message you. As many of you know, we do record these sessions, and so within the next 24 hours, you'll be able to get the full content of the event. We do not have really a PowerPoint deck today, but you will be able to hear the full conversation. Resources at the Greater Houston Partnership around COVID-19 can still be found on our website at houston.org coronavirus. You're going to get information such as general resources, industry best practices. We do have a monitoring dashboard. It provides weekly information about what's happening on the health side, business, economy. Also our Business Recovery Center that has information for small businesses, our Reopen Houston Safely report, and our WorkSafe principles. So you can find all of that at houston.org coronavirus or houston.org events. We'll list out any upcoming events that are on the docket for the next couple of weeks, and you can register there as well. So throughout today's program, we are going to be talking about managing COVID-19 cases in the workplace, and we do have a document that's available. Shireen at this moment is going to put that in the chat, so you'll have an opportunity to follow along, but we'll also bring that document up to reference during the program. We do not have a poll today, so if you do have any questions about future programming, or you'd like to share with us what some of your pain points are right now, we'd love to hear from you, and you can put those in the chat box as well. I will just have a final mention and a disclaimer that all the information you're going to hear today and the information you're going to read today, note that we still advise you to seek your own personal counsel to assure, because ultimately each of you have a separate situation and then you'll want to get separate counsel for that. So please do refer to your legal or healthcare counsel. And again, we are very delighted to bring to you this particular program. It is very timely. One of a couple of the reasons why we've produced this particular report, it's really a second step in the process around COVID-19 in our Work Safe program, is we have found that there's been a lack of clarity around what employers should do even if an employer were to fall ill. So this is an opportunity for us to run through some of those things, some of those steps. I know a lot of the businesses, a lot of our HR employers and employees are very concerned and have a lot of questions for our organization. So what do we do if an employee gets the virus? They've been to the office, and how do we, what kind of guidance can we provide? We've also reached out to many of you, and there are a couple of other questions that you have asked us related to workplace cases. We're also going to share information about public health. We're going to share legal advice today as well. We're going to go ahead and get started, but we want to make sure that you have access to the information that we're addressing today. And again, in the chat box, there is a link, and then you'll be able to follow along with us. Okay, so with that, let's go ahead and start today's program. Let me share with you some information about our speakers today. It is a panel, and we're going to go ahead and do a moderated chat for the first few minutes, and then we'll go into some of your questions. So feel free to add your questions in the Q&A tab. Our first speaker today is Jenny Phillip, and Jenny is actually here with us at the Greater Houston Partnership. She's our Senior Vice President and Chief Strategy and Innovation Officer, and previously our Vice President of Public Policy. She spent several years directing also our research efforts for the partnership before joining the policy team. So today, Jenny is actually going to be acting or representing our employer community, and she'll be referencing the Managing COVID-19 in the Workplace document that we'll bring up in just a moment. Our next speaker is Rufino Gaytán, and he is an associate with Locke. He has extensive experience advising clients on workplace health and safety issues, and he has represented clients before OSHA, the Occupational Safety and Health Administration. Rufino is well-versed in numerous issues stemming from the COVID-19 outbreak, the Family's First Coronavirus Response Act, FFCRA, the CARES Act, stay-at-home and related orders and all their effects on employers, employees, and independent contractors. So in addition to this new part of his job, he is providing day-to-day counsel on general human resource issues. So we want to welcome Rufino to the program today. Thanks, Rufino. And then we have Dr. Susan Tortolero Emery, is a professor and senior associate dean of academic and research affairs at the UT School of Public Health. Dr. Emery was director of the Center for Health Promotion and Prevention Research, which develops, evaluates, and disseminates health promotion and disease prevention programs in diverse settings and populations. She was also director of the UT Prevention Research Center, which focused on developing effective strategies to promote health and prevent disease among adolescents in Texas. So we're very pleased to have her today. She's actually serving right now and managing the collaboration between UTHealth School of Public Health and the Texas Department of State Health Services to assist in the state's COVID-19 contact tracing efforts. Thank you so much, Dr. Emery, for being here today. Jenny, Rufino, appreciate you being here. We're going to go ahead and get started and have a discussion here with Jenny to talk about managing COVID in the workplace from an employer's perspective. So Jenny has had an opportunity. Remember, the partnership represents about 1/5 of the employers in the Houston area. So we have been doing a lot of research related to and asking a lot of questions of our employers. And so Jenny has gathered some of this information. We're going to talk a little bit about that with her today. Jenny, I'm going to bring up the Managing COVID document right now, but if you could just share a little bit about what employers have been discussing with you, how they manage confirmed suspected cases.
Absolutely. Thank you for hosting us. You know, we were working through a lot of the reopen guidance and trying to put together the overall document about how to reopen safely. And we reached out to a lot of our employers who are in essential industries. And so they have been functioning through this whole time. And many of them have experienced outbreaks within their facilities, within their workforce. And so they wanted to be able to share what they've learned through this process so that other companies that are going through and kind of figuring out how to reopen don't have to go through and make the same, I wouldn't say mistakes, but go through that same trial period as they did. And also a lot of these companies may have a lot of resources to dedicate to developing these kinds of policies and procedures. And they were very forthcoming to say, we would love to be able to help those companies that don't have as many resources to create those kinds of documentation or support materials and share that with the partnership members. So really this document that Carrie's sharing is a culmination and a kind of a collection of that information and reaching out to public health authorities, to the medical center leaders, and really gathering that information, obviously CDC, OSHA, ADA, to come up with what could be boiled down to what is a very complicated matter and very complex. As I was putting this together, it felt like I was writing one of those choose your own adventure books that you used to read when you were a kid. If you come to this scenario, then what do you do? And if you go this way, then what happens next? But to try to simplify it as much as possible, there are essentially these 4 I's that you can follow. And the first is to identify. And Carrie, if you want to go down to that section of the document. And the first step is what many of employers are already doing, which is screening their employees, right? Having those daily temperature checks, asking for questions about symptoms, asking if they have been around someone with a confirmed case, to kind of have that first measure, first defensive measure to prevent that case from coming into the workplace. There are other screening mechanisms that can be utilized as well. And beyond that, let's say that there is a confirmed case in the workplace. And what we've noticed is that there's a lot of guidance about preventative measures. But there was that gap of, well, what do we do when there actually is that confirmed case or suspected case in my workforce? And so really this next one is when you start acting, right? And that is, first thing, isolate. Some employers have an isolation room within their workplace. So before an employee, as immediately as you can, you want to send that employee home and have them isolate. In the interim, if there is not a way to have them sent home, there should be an isolation room, which immediately afterwards should also be, sanitized, disinfected, et cetera. And that isolation period also extends to how HR or whoever the designated company representative talks to them about that isolation period. Then the third phase of this is what we would misrepresented in terms of calling it contact tracing. Part of this effort was also learning. It was a big education from the employer side that this isn't what you would call contact tracing. That's more of a public health action that Dr. Emery will touch on. But really it's about how do you investigate, right? So that's that third step. How do you investigate and understand who were those close contacts of that confirmed or suspected case where there was potential exposure. CDC says if it's 6 feet of proximity of that engagement over a 15-minute period or longer, or if you know that there was bodily secretions like a cough that you were exposed to, you could categorize that as someone that you would consider a close contact. A lot of companies will ask their employees to create a daily log. This is basically to say, who have you come in contact with today? We know that this is really hard for companies that have a lot of customer-facing interaction or client-facing interaction. And so sometimes that's modified just to say, who did you have close contact with? And the reason for this is because it's really difficult when someone who falls ill is then asked to have to recall all of their interactions, over a period of time when they aren't feeling well, when perhaps they're scared, when they are also perhaps feeling guilty if they expose their family, their friends, or coworkers. And so, when they are in a more head place where they can be objective about providing that information through those daily logs, we've noticed that that's been very helpful for employers to enact in their daily practices. And that final step, and Carrie, if you want to go down to that next page, that final step is to inform. What we mean by inform is that after you gather who those close contacts are, you can notify those contacts that they have been, in proximity of someone who has either a confirmed or suspected case, and then lead them to kind of guidance from the CDC on what next steps they should take. And there are links throughout this document that help, kind of guide you to those next steps. The links are also intentional because, as we've all experienced, every day there's kind of a new development in what the best guidance is and what we're learning about this virus. And so all of this is intended to sort of be a framing, but then guide you out to the most recent resource, particularly with the CDC. So in terms of informing those close contacts and letting them know about next steps, although it's not required for employers to tell their entire workforce that there was a confirmed or suspected case, when speaking with a lot of companies, and also just kind of what innately, it's just best practice to share that information, because oftentimes it gets shared anyway, right? When you tell the close contact within the workforce, that word will spread to those who weren't considered close contacts. And you want to continue to build trust with your workforce as you reopen and as you navigate through the coronavirus, that, you as an employer or as a manager, you're doing everything you can to keep your workforce safe and your employees safe. And so it may create, some concern or fear within your workforce, but we have found through employer experience that it's better to share that up front than for them to find out kind of through the grapevine. What we've noticed that has been helpful in that correspondence is to say, there is a confirmed or suspected case. We are monitoring it. We are letting you know. If you did not receive notification from us that you were a close contact, no further action is needed. Continue to monitor symptoms if, to basically make yourself feel better. But if you are not a close contact, no further action is needed. And those are those 4 steps. What's important, though, through all of this is to remember that these are your fellow coworkers. These are your friends. And what is often lost because we're just trying to rush to get guidance out and rush to make this as helpful as possible is that human element, where when you are working with an employee who has a confirmed or suspected case, to absolutely approach that with as much empathy as possible, and to understand that they are likely scared or concerned or just not feeling well at all, and to be just to remember that and have that perspective as you go about these 4 steps. And the final thing is there's a flow chart where we look at there's some businesses that have a much more dynamic work environment. They work with a lot of contractors, a lot of third-party vendors. And so this may look kind of overwhelming, but in terms of like a step-by-step, what do you do? If yes, do this. If no, do that. This is really for that process to kind of go through those step-by-step. So.
Right. No, excellent information. And I do want to remind our audience today that the link to this document has been placed in chat. So you're welcome to follow along with us or download it for later use. And you may have some questions for Jenny at some point throughout this workshop today. So please do take a look and let us know if you do have any questions. I know it's a lot of information, so we're not expecting you to read through it all right now. Dr. Emery, if I can bring you up for a second, there's been a lot of questions related to contact tracing. And so how is this managing COVID cases in the workplace different from what we're hearing around contact tracing?
Right. This is a great question. And first, I want to praise Jenny for her efforts on this. And she does deserve an honorary epidemiology degree, I think. she's become very knowledgeable. So there is a lot of confusion about what contact tracing is, and a lot of businesses are using the word contact tracing, but really contact tracing is a specific activity conducted by a public health authority, a health department or another public health authority. And contact tracers are trained to do that type of work. They follow up with the infected or suspected individual. They will obtain information about all of their contacts, workplace and other contacts, and then they'll start to investigate. So it seems very similar on the surface, but a contact tracer is going to ask much more detailed information about family members and all contacts, which a workplace would not want to do. And they're also going to problem solve and brainstorm with the suspected case about isolation, about resources. And so it is a very different activity, and we don't want to confuse those activities because you don't want to confuse your worker that the contact, that you're taking the place of what contact tracing is, right? You want them to participate in the official contact tracing activities, but employers have a key role to play in identifying suspected cases, isolating them, investigating those work site contacts, but they also, and informing others, but they have to be careful about, divulging the name of the individual. They need to protect that, health information as well. So it's a very different activity than contact tracing is.
Well, great, thank you. I know a lot of people needed clarification, and that's just a term that it goes around, and it's important for us to know the differences there. So Rufino, again, thanks for being here today. You're our legal rep, our perspective, I should say. So what are employers allowed to do? And when they're identifying confirmed or suspected cases and then notifying contacts?
Yeah, absolutely. Thank you for having me here, and thanks everybody for attending. In terms of what employers can do to identify, everything that Jenny just talked about, you want to be proactive about it. And from a legal risk mitigation standpoint, right now we are in these unprecedented times from a legal standpoint. We don't really know what courts or administrative agencies are going to do with regard to an employer's efforts to maintain a safe workplace. What's going to be enough, what's going to be the threshold. There's talk about, potential legislation or executive orders granting some level of immunity to businesses. But, all of that is so speculative. And at this point, it's so early on that I don't think any business should rely on getting any sort of immunity. So the best thing to do is to be proactive. And a lot of the things that Jenny just explained are exactly what, I've advised many clients to do already. In terms of identifying an actual COVID case or somebody who may be suspected of having contracted the virus, it's things like talking to that individual is key, of course. Making sure that they understand what it is their responsibilities are, and then trying to get information from them, and I've also been cautioning a lot of clients about using the phrase contact tracing in their policies and whatnot, because it's not what the actual concept is, but you do want to identify who have you been in contact with, have you been in any meetings with other coworkers, and for employers, the focus really should be on their own employees, because that is where your most direct duty and legal obligation is to make sure you protect those employees. So which employees have you been in contact with? What meetings have you been to? Have you been in contact with customers or clients? And then trying to, once you've determined this person's level of exposure, if they know they're positive or they just have all the symptoms but haven't been diagnosed or tested positive yet, you still want to be proactive and reach out to those close contacts to say, hey, somebody within our workforce has potentially been exposed to this virus. We want you to just sort of monitor your own symptoms. If you feel ill, certainly don't come back to the workplace. If you need to go get tested, go do that. Encourage them to do all of those things, but you definitely want to put sort of everything on pause for those who you've identified as close contacts. Dr. Emery touched on this just a little while ago as well, is the most important thing really is to maintain the confidentiality of that person's identity. One of the questions that we are getting a lot is, well, isn't it going to be obvious to the coworkers who this potentially sick employee is? And that's probably true. I think employees will know. Sometimes that coworker who is infected or potentially sick may be the one to reach out and say, hey, I think I may have contracted the virus. Just be careful, watch your symptoms, stay healthy. But while that's probably true and it's going to happen inevitably, it's still your obligation as the business owner, as an employer, to make sure that you keep that information confidential. And if an employee or a coworker happens to figure out who that person is, then that's okay, as long as you don't confirm, yes, you're right, or deny that that's the person who is ill. So confidentiality throughout this process is always going to be a key, whether it's through documentation or just having those verbal discussions with the close contacts.
All right, great. So really it's about the employer notifying staff that you may have come in contact with someone in the office versus giving a specific name of an individual.
Yeah, absolutely. And then once you start to figure out, let's say it was a false alarm, then you obviously want to be proactive on that end as well, because you don't want to have people worried out there that they may or may not be sick when there really wasn't an actual exposure.
Right, absolutely. Well, great. Thank you for that. We'll come back to you. There's a couple of other questions for you, Rufino. Dr. Emery, back to you. So how can our businesses, how can employers help public health efforts in containing COVID-19, especially now that we're seeing potentially, or not potentially, but an uptick in cases with reopening?
Yes, so employers, businesses are key in really setting control measures and in identifying potential cases, and then very quickly isolating those potential cases and then notifying their workforce. So employers are really on the front line, and so they are critical in encouraging their employees to report their symptoms, to isolate, and then to educate really their workforce as well. So employers can report. It is legal for them to report a case to the health department, but you can also encourage the employee to report the case to the health department as well. So employers are such a critical arm in really fighting COVID-19 and mitigating this virus.
Absolutely. So again, Jenny, back to you in terms of kind of representing the employer's, perspective here. What is it that we can do, or what can employers do to help with self-reporting of symptoms?
Yeah.
What is our obligation there?
To build off of what, I'll get to that, and then to build off of what your question to Dr. Emery was, there's an audience question here about, are employers required to inform public health authorities if there is a COVID-19 case? So kind of that operative word is required. And I just wanted to point out that, Dr. Emery said it was recommended, that this is something that, and you are legally clear to provide that information. So in terms of you must provide the confidentiality of that person's identity when sharing out with your workforce. But when it comes to public health agencies, you are allowed to share the identity of the employee of the confirmed case. And although it's not required to share that with public health agencies, for all the reasons that Dr. Emery had just said, it is absolutely recommended in terms of being able to fight this, this virus and community transmission. And since, you know, employers really are kind of on that front line of stopping that transmission, it really is encouraged. And in the document, there's some phone numbers, you know, contact information of who those public Harris County and City of Houston public health numbers can be to reach out to. So going back to the original question of, you know, what can employers do to encourage, you know, employees to come and you know, be forthright. You know, one is to reduce the kind of what you would say disciplinarian, or take away the negative you know, disincentives for an employee. And so, you know, Rufino can touch on this later, but, you know, the CARES Act has provisions in the FFCRA to be able to provide for those who do need to take time off to recover from this illness, or to isolate or quarantine, you know, to be paid for that time. And, you know, I'll leave that for Rufino to cover. But so there are certain things that employers can make sure that employees know that they have access to, so that they aren't concerned from a financial perspective why they shouldn't take certain measures, because I'm sure they'll think, well, if I say that I'm sick with this, they're going to tell me I can't come to work, and I need to be able to pay my bills. And so for them to be able to understand, you know, what is available to them through the federal actions, also kind of take a look at your internal policies on paid sick leave, on PTO, and that's one of our work safe principles that the partnership has been promoting. So, you know, absolutely encouraging to take away the disincentives. And then the other is, it's almost more of a discussing about the behavioral actions of what you as an individual can do to stop transmission within your workforce, within, you know, among your coworkers. Nobody likes to be told what to do, right? No one wants to be told you can't do this or you must do that. And so there has to be actions from the employer side to communicate, you know, the importance of why individual action matters on a very macro scale. And, you know, additionally, it's an interesting time right now because the perceived risk of coronavirus has shifted, right? When everything was locked down, but while cases were still building in terms of community transmission, people were, you know, they were wanting to learn everything about what they can do, you know, wash my hands for 20 seconds, wear a mask, you know, do all those right things. But to an extent, there's become fatigue, right? We're tired of being stuck at home. We're tired about having to think about every risk there is. And so there's fatigue there. But, and you know, with certain actions of reopening, it almost signals as if the virus, we're okay now, right? Why else would we reopen if everything's fine, right? But the virus still exists among us. And we can very well be infected today as much as we were when everything first began. And so there's this odd shift in perceived risk. And there needs to be a reminder from employers that this virus is still, you know, very much living among us still. Everything we're doing right now is to figure out how do we, you know, not completely shut down the economy, because that doesn't help either. There are other risks associated with that activity. So how do we live with the virus, and how do we prevent a situation where it gets so out of control that we need to shut down? Again, which we hope to not get to that place. And so from a simple action of taking your own responsibility can really, I mean, you can really prevent a slide towards that direction of such extreme measures.
So there's certainly a lot of responsibility on the employee here, as there would be legally for the employer, but just kind of your own responsibilities as an employee. So from a legal perspective, Rufino, what is the employee's responsibility? And I mean, how much of that is legalese versus, you know, just the ethical component of reporting, you know, illness or something like that to your employer?
So from a legal standpoint, an employee, at least as it relates to his or her employer, their obligation is really to do whatever their employer allows or prohibits. And so there are a couple of questions in the queue about, an employee who either refuses to stay home if they are confirmed ill or they refuse a temperature check. You as the employer are, the king or queen of that place of employment. And if you are going to set up a policy that requires everyone to go through a screening, whether it's a health questionnaire or a temperature check or something more, even more invasive like an actual COVID-19 test, then it is that employee's obligation to follow through with those procedures. And if an employee refuses to abide by those requirements, you as the employer do not have to grant them access to that particular facility. And that is key, because from a legal liability standpoint, the EEOC has said very clearly that an employer can do temperature screenings, can ask those relevant health-related questions about potential contacts or exposures with others, and can actually do COVID-19 testing. So there's not going to be a disability discrimination risk there for an employer who makes all of those steps requirements. And it also, from a health and safety standpoint, shows that you as the employer are taking this threat very seriously, and that you are trying to comply with what the CDC and OSHA and other public health agencies are currently saying are the best practices. So, to the extent that you do have those issues come up, that is something that you have a lot of leeway in currently. The one caveat, and I know that there are several employers who have tripped up with this issue already, is that if you have an employee who says, I do not want to come into whether it's an office or a job site because I don't think it's safe to do so. Well, the minute that safety becomes an issue, that communication from the employee is protected under the Occupational Safety and Health Act. And so you cannot, as the employer, terminate that employee simply because they have expressed a safety concern. The way that you should treat that, ideally, would be very similar to how you would treat an accommodation request under the ADA, right? So talk to the employee. Say, hey, what is the issue? Is there something that we can do to make you feel more comfortable about coming into this work site? Explain to the employee what you're actually doing already. Say, we're going to provide everybody with face coverings. We're going to provide gloves and hand sanitizer, whatever precautions you're taking. Because it could be that the employee just doesn't realize that those are the precautions that are in place. Now, if after you've gone through a thorough process of this back and forth with the employee, if the employee's fear is now no longer reasonable, then at that point you can address it as a disciplinary matter. But even then, I would caution you, most employers against doing that unless you've actually talked to legal counsel about the specific situation in those circumstances.
Thank you. We're going to open up to these next few questions to the full panel. So feel free to take it if or to share the question, I should say. Technology. In light of everything that's going on, and in terms of the data that we're trying to obtain, there are apps, there's analytics tools that are out there and accessible. So should businesses be investing in these new apps to help track employees and their symptoms? What's your take on that? Are they applicable at this point? Do they work? Should employers do it? What are your thoughts? Rufino, we can start with you, or Dr. Emery, you could kind of give us a sense of, do they work actually?
But really depends on the scope of the business and what you're trying to accomplish. So sometimes a spreadsheet is fine if you're logging or tracking. But if you're a large business and you have employees interacting with others, there are tracking apps that work very well. I would also say take advantage of the symptom tracker apps and encourage your employees just to routinely use those and do some self-assessments as well. So it really depends on the purpose of the app and the tracking device. I would look at it very carefully about what the objectives are.
Yeah, and from a legal standpoint, I agree with all of that. Recommending to employees that they do something that will allow better contact tracing potentially, or even just, and I mean that in the real sense of the word or the phrase, or allow you to better identify close contacts within the workplace. All of those things are tools that are at your disposal, and to the extent that you can manage those, I think that's a good idea. The only consideration that you should take into account, or one of the considerations really, is what do you do with all the data? Are you going to actually handle the data? Is it just going to be limited to whatever an app spits out, as the data once the user information is uploaded somewhere to the cloud or wherever it might be? But you as the employer, if you do come into contact with any of that information, you have to treat it very carefully. In most instances, it's likely going to be confidential medical information that needs to be kept in a separate medical file for each employee that you're collecting the information on. If you're using a third party, whether it's an app or an occupational health service, you want to address those issues in your service agreement with that third party as well, just so that everybody understands what their obligation is with regard to that information.
I would add that before, because these apps, some of them can be fairly expensive because they may come with a hardware element to be able to collect that information. And, so you want to weigh in sort of that cost and then understand fully what are you trying to accomplish by deploying that technology. Because if that can only be accomplished by a very broad adoption by your workforce, then you may need to think about, because you cannot make it compulsory that they log in or they allow for their movements or for their contacts to be shared on that platform. And so knowing that it can't be compulsory and that it should be voluntary, or it must be voluntary. What are you trying to accomplish, and can you accomplish that if you don't have the adoption rate that's needed? Someone had shared with me that Singapore, which is one of the most kind of like, I tell you to do something, you do it sort of societies, in their public health realm, their contact tracing application has 40% adoption. So you think about that, I mean, that's a population that you would expect, the flip of that. Even that, there's very low adoption there. So just taking that into consideration before, signing an agreement with the developer or purchasing, a wearable device for every employee. But there are also a lot of benefits. There's a question on here in terms of, can you comment on companies' experience with the daily contact logs? A lot of questions about, how do you go about doing this? There are a lot of wearable technologies that they'll ping each other. They'll kind of give you a little vibrate if you are within 6 feet of someone, right? Or that all of this starts getting pulled in. If you had been within 6 feet, that person that you were in 6 feet of for more than 15 minutes gets automatically logged in, on some sort of database. Those are for companies that have resources to be able to pay for that, right? And so, it's really an individual company by company situation of what they can bear and what their employees are willing to do. They're absolutely best practices, but it's a very situation. And, it's helpful to be able to pull that information easily into like a data management system. But like Rufino said, what do you do with that? And how do you make sure that, privacy is maintained? And, that for one, the app developer is not utilizing that information in a way that was not intended. And the final thing I would point out on this is that when talking to the large employers, and many of people on this call may either be an employee of that, or in charge of the contracts with vendors, third-party groups that would provide these services, or perhaps you are a third-party provider, what we're finding is that particularly energy companies, they are folding this into their daily safety routines, right? I mean, energy companies, they are, you have your safety moment before every meeting, you have very deep safety protocols. They're just folding in this COVID-19 element into their requirements for their contractors and their third-party vendors. So what I'm saying is that you may not be developing it for your workforce now, but if you work very closely and are trying to get contracts with these large, particularly energy companies that are very safety focused, they may actually require you as a contractor or vendor to follow a lot of those same kind of daily log activities or utilization of a specific app that they would like you to use as well. So just be aware that if it's not happening now, you can anticipate those conversations happening in a few weeks or a month or so.
Yeah, Jenny, the partnership has a monitoring dashboard that we update weekly, and it's on our website, coronavirus website. Do we track any information related to the use of any of this technology at this point, or what are you seeing in terms of adoption of the use of technology? I know
there's not one. Yeah, the dashboard's really meant to kind of track overall activity of society. And so we don't have access into kind of what each employer is doing and what choices they're making because it is so industry specific or company specific for what they do.
Okay. Well, for our audience today, if you want to go ahead and pop into the chat area, if you have used any technology to monitor and track, that would be kind of helpful information. It's not a poll per se, but it would be interesting to learn if you are using that at all. All right, well, a lot of the questions that have come in through the live Q&A from our audience, they're similar questions to what we have been talking about. Some are nuanced just a little bit. So I'll go through those and see if we can hit a couple of questions directly from our audience. One thing, Rufino, maybe you can answer. Waivers. So we're reading a lot about whether or not waivers should be created by an employer, and not so much for the employees, but let's talk a little bit more about visitors to your property or your suppliers or vendors that are coming through. And or in Houston, we have a large meetings and events industry, hotel, restaurant. I mean, what do you do when those folks frequent your establishment? They're not employees, and do you fill something out, and will that ultimately release you of liability?
Yeah, so it's a great question, and I think you're right to make the distinction between employees and essentially non-employees. For employees, by and large, in Texas and in many other states and jurisdictions, they're just not going to be enforceable almost to any extent, really. For visitors and customers and anybody that's not in an employment relationship with the business, there can be enforceable waivers of liability related to that person coming onto those premises. The key distinction or the key consideration in those scenarios is waivers do not generally apply or are enforceable in situations where that business is just grossly negligent or has done little to nothing to try to prevent the spread. In the case of COVID-19, the spread of this virus. So if you're a business that's going to open up and you're taking no precautions and you're asking visitors to sign a release of claims as a condition to accessing the premises, and you do nothing, it's the likelihood of that waiver being enforceable significantly decreases. Whereas if you are a business that is requiring all of your customers to wear face coverings, such as a grocery store, your Costco's of the world, and you're sanitizing all your carts or whatever you're sanitizing high touch areas on a daily basis, if not more frequent. The more of those things that you're doing per the CDC's guidelines, the better off that waiver might actually be. So those are some of the, it really is a cost benefit analysis. Like how much risk are you really willing to take versus doing, the best practices anyway.
Yeah, and Stephen asks a question on our Q&A, which I know we didn't answer your question, Stephen, because he is specifically asking about how this conversation seems to be geared more towards office work, right? And I know that is not necessarily the case. There's a lot of different industries we've referenced. And just this last question was kind of concentrated on other types of venues, but really, what are restaurants and other groups going to do? This is a very difficult situation for them when they have so many visitors coming through and trying to keep track, especially if their employees are now potentially picking something up from a visitor that comes in through their establishment. I'm not sure that's a question that any of us can answer, but it is something clearly that our industries need support on in terms of what are they to do, because they're trying to reopen as well, and they're trying to keep their employees safe in the process.
We spoke with the Houston Restaurant Association and the Texas Restaurant Association, and it's a very complicated matter because the spectrum of the service that they provide, and you've got your chain restaurants that may have a lot more access to even just PPE or sanitization materials than your hole in the wall mom and pop kind of service stand. Then there's also if you go to the website, the Texas Restaurant Association website, there is a Texas Restaurant Promise, right? That have listed out sort of like, here are some guidelines that we believe every restaurant should follow. Are they enforceable? That's the same thing that we are grappling with, not just within restaurants, right? But this is across every industry. Or there's always these recommendations of what you should do, but who's actually going to come in and make you do it? And so from that perspective, that's where the customers come into play. And there's absolutely things that you can do. You can say, to the restaurant owner, I am leaving your establishment because I see that you are not using disposable menus and that you are not distancing your tables and that your servers are not wearing masks. And, so you can look at the Texas Restaurant Promise and kind of arm yourself as a customer to know what to expect when you walk into an establishment and kind of visually see if those safe measures are being taken, and say, hey, I would love to patronize your restaurant, and I'll come back next time when I see these things happening. And so that can create some enforceability and perhaps incentive, right? Because to them, that's income that's walking out the door at that time. But in terms of what the restaurant industry as a trade association can enforce their restaurant to do, that's a lot more difficult.
Yeah.
So go ahead. Sorry.
I think, one thing I'll add is for restaurants in particular and several other industries, including construction and numerous others, OSHA has published within the last couple of weeks, 3 weeks maybe, industry specific guidance on COVID-19 precautions. I throw that out there just so that everybody knows. If you want to go look at the OSHA website, you should, but there's nothing really groundbreaking in there. For restaurants, for example, one of the recommendations is, have designate certain parking spaces in your parking lot as, pickup only, and make sure that you follow social distancing within, that part of the restaurant where you're doing the pickup orders. And it's all things, at least in my experience, that most restaurants are already doing anyway. But there are some of those guidelines out there. And I would say that if you've got questions about a specific industry, get on that OSHA website, and their COVID-19 resources may actually touch something within your industry.
We only have time for a couple more questions, but I'm reaching out to our audience right now and making sure we're answering as many of theirs as possible. But, is the 14-day quarantine kind of rule, isolation rule, still applicable here? I mean, we're coming into contact with so many different people at so many different stages that if you suspect you have been you potentially have symptoms or have come in contact with someone that potentially has symptoms or has it. Is that 14 days still the rule? I mean, what are we looking at here, and what would we advise?
I wouldn't use the word rule. I would use the word guideline, because all of these are guidelines and they could be changing, but currently the thinking is 14 days. I think in the previous question and conversation, it's very frustrating because we want to have control of everything. And, working in a restaurant and customers and all of that, it's very hard to ensure that, we're notifying and controlling, but that really goes to having a very transparent symptom checking in your worker population. Really using that, monitoring the symptoms as a way to sort of combat the spread, and doing that consistently throughout is very important. And then using the 14-day quarantine and recommending testing as well.
So, if the individual or employee themselves has not been, does not have symptoms, but they've been in contact with someone that has, and what extent should they report or have the employer inquire about any outside exposure? I think that's more in line with the question here, is like, what should the employer be asking about all of your interactions?
So in a screening or symptom checking questionnaire, you could ask if you've been in close contact with somebody who has COVID-19. You don't want to ask specifically about family members, but in general, have they been in contact? And then a further assessment of how much time and how close the contact was. And then really this is an art to sort of then decide how you might instruct the employee to quarantine based on those.
Yeah, if our panel has a moment or two to just look at those Q&As, there's a couple of other questions. I think they start to get into some specifics about their particular workplace. We have some related to nonprofits. We have some related to church services. So you might want to just kind of pop in there and see if you can answer those questions. We are kind of running out of time right now. I would say that another question that comes up frequently is restricting your employees from attending other events, because there's obviously now going to be more things opening up. So is there going to be, or are we advocating at all for a restriction of other events, or we would just use what we have discussed today, the Managing COVID in the Workplace document, Jenny, to just advise to take precautions that you normally would, or we're recommending any kind of restricted behavior?
So I'd be curious to see what Rufino thinks, but I don't think you can require outside of work that employees restrict their activities. But I think that communication and messaging and really motivation of your work site to work together to protect each other is the way to go.
Yeah, I definitely agree. It's not a good idea for an employer to start to dabble into what their employees can or cannot do outside of the workplace. But to the extent that they do become ill because they attended a concert or whatever, you do have a right to ask about those contacts, whether they are ill, and setting up those processes that we've described throughout. One thing that I'll add sort of as my final sort of suggestion for most businesses is and Dr. Emery alluded to this, we do always, and especially as attorneys, we want to have as much control of every little aspect as we can, because it makes it easier for us to address, you know, the level of exposure here. That's just not feasible. It's not a realistic scenario. I think the best thing that any business can do really is focus on the general guiding principles, right? And the CDC has, for months now, stressed the importance of social distancing, personal hygiene, you know, washing hands, using disinfectants, disinfecting high contact areas within a facility. All of those are still the most important things that anybody can do to prevent the spread of this virus. And if you build off of those guiding principles using that awesome document that Jenny shared with us, I think that will get most businesses where they need to be in line with the latest guidance, and just monitor the guidance, because it is going to change eventually. But so far, those are still the sort of core principles of, you know, the best protocol to combat this virus.
Right. Thank you. Well, thank you to all of our panelists today. We very much appreciate it. Again, trying to bring the timely information around COVID-19 to our employers, our members here at the partnership, and the public at large. And you all have certainly done that today. As a reminder, the partnership does have its Managing COVID in the Workplace document available. And as Jenny pointed out earlier, there are links associated with it, with the information that will be constantly updated. So know that we are trying to keep things as timely and relevant as possible. Again, thank you to our panel today. All right, well, as we wrap up, I just want a couple of announcements. We have a couple of events coming up, not next week, but the week after, I think, that are very important to this audience. It is discussing the economy. What are the latest updates around our energy sector? Patrick Jankowski, our SVP of Research, will be delivering a new series. It's an economy series, a webinar series, and his focus will be on the economy and energy for the one on June 23rd, and thanks to PNC Bank for sponsoring that. On June 24th, the day after, we'll actually be talking about global supply chain, the effect of COVID-19 and the downturn in the oil and gas industry on those global supply chains. So you want to tune into that as well, both free to our members. And the Business Beyond Borders programming is brought to us by Mitsubishi Corporation Americas and Haynes & Boone. So thanks to all of our sponsors and supporters. Thanks to everyone for joining us today, spending your time with us. We'll continue to get information to you on our website and in our blog posts and daily emails. I'll leave this information up on the screen. If you have any other last minute questions or anything you want to plug into chat, we'll be able to respond for the next couple of minutes. Thanks and have a great afternoon.